Good day, this is Professor Will, CBMD PhD. Today is Tuesday, June 16, 2020. It is 1:27:57 seconds a.m. Eastern Standard Time. This is a continuation of my Corona series, so let's get started here, as we're slowly going into summertime. Combination drug treatments for COVID-19 show promise in cell culture tests. Clinical testing should be an urgent next step, researchers say. Date June 15, 2020. Source: Norwegian University of Science and Technology. Summary: researchers have established a cell culture that allows them to test antibody-laden plasma drugs and drug combinations in the laboratory. A screen of 136 safe and human antiviral drugs and identified 6 promising candidates. One combination of 2 drugs was so effective that researchers hope others can begin clinical trials on the drugs now. 6 months into the COVID-19 pandemic, more than 7.4 million people have been infected, and more than 410,000 have died. As yet, there is no treatment or vaccine for the disease. Now, a team of researchers have looked at different possible treatment options and found both good and bad news. The good news is that the team identified 6 existing safe and human broad-spectrum antivirals that worked against the disease in laboratory tests. 2 of the 6, when combined, showed an even stronger effect in an infected cell culture. This is exciting new data from the work researchers investigated. The bad news is that another non-drug treatment, the use of antibody-laden plasma from recovered patients to treat the severely ill, may only work if the donor has recently recovered from COVID-19. This means if you collect blood from patients who have recovered from COVID-19 after 2 months from diagnosis of the disease and transfuse their plasma serum to severely sick patients, it may not help. A study has been published in the journal Viruses. The research team developed a cell culture that they could use to grow SARS-CoV-2, the name of the coronavirus that causes COVID-19. The culture allowed them to actually test the efficiency of the different drugs in the laboratory. They determined that a cell type called Vero E6 was best suited to propagate the coronavirus, and were able to screen 136 drugs using the cell culture. The screening identified 6 existing drugs that had some effect, and several combinations of drugs that acted synergistically. The combination of Nelphanar and amodiaquine exhibited the highest synergy. This last finding was encouraging enough that the researchers hope that others will follow up and start testing the drug combinations in patients. This orally available drug combination, Nelphanar and amodiaquine, exhibits the virus infection in cell culture. The researchers also wanted to look more closely at the efficiency of using blood plasma from recovered patients to treat people with COVID-19. The Vero E6 cell line enabled them to develop a neutralizing antibody test, which they could use to determine the strength of antibodies from the blood recovered patients. The neutralizing antibody test works much like its name suggests. The researchers took blood plasma from recovered patients and added it to the cell cultures containing the live virus. That allowed them to see how effectively the antibodies in the plasma neutralized or killed the virus that was growing in the cell culture. Researchers call the plasma from recovered patients convalescent serum. Convalescent serum from patients containing antibodies against the virus has been used for treatment of different viral diseases over the last decades, with some success when vaccines or antivirals are not available. If used for treatment, it is essential that the convalescent serum contains enough antibodies that are capable of inactivating or killing the virus. But research points out that the only way to know if the convalescent serum is strong enough is by adding dilutions of it to a live virus strain and testing the mixtures on cell lines that can propagate the virus, as the researchers did. Ordinary antibody tests may not reflect the ability of the convalescent serum to actually kill or neutralize the virus. That means the neutralization tests are still the most specific. The neutralizing antibody tests allowed the researchers to test convalescent serum from a number of recovered patients. They were able to see that some recovered patients didn't produce lots of antibodies at all, a finding that has been confirmed by other research. They also were able to see that more recent the recovery from COVID-19, the more effective was the serum. 2 months after a patient had been diagnosed, their serum didn't have enough antibodies to combat the virus in the cell culture. The conclusion so far is that clinicians need to collect plasma for treatment purposes as soon as patients recover from COVID-19, because the amounts of antibodies decline with time. However, this finding is not contrary to the notion of lasting immunity. If the patient was exposed to the virus a second time, the cells of the immune system would most likely be prepared to increase the production of antibodies again. The fact that the researchers had been able to diagnose and isolate the virus from patients gave them the chance to identify the origin and evolution of the viral strains. This was achieved with the help of a new nanotechnology based for COVID-19 that was spearheaded and adopted by the Norwegian government and that could potentially be exported for use in other countries. By determining the genetic makeup of the strains, the researchers were able to compare the strains to those registered in the online resource and figured out where the different strains originated. We determined that the SARS-CoV-2 strain isolated in Trondheim had originated from China, Denmark, the USA, and Canada. That raises the question of whether or not Norway's travel restrictions enacted on March 12th should perhaps have been introduced earlier to prevent the import of the virus to the country, the researchers said. But seeing how strains are moving across the globe offers potential helpful insights into the virus and its transmission. Monitoring pathogen epidemiology and the evolution of the virus helps with our epidemiological understanding of the disease and may improve outbreak response. Researchers had previously gone through the academic literature to identify what are called safe-in-man, broad-spectrum antivirals, abbreviated BSAAs. These are drugs that are known to inhibit human viruses that belong to the two or more viral families and have passed the first phase of clinical trial. That database of the drugs was published in the International Journal of Infectious Disease and is accessible. The authors also identified 46 BSAAs that could potentially act against the SARS-CoV-2 virus, including remdesivir and favipiravir, which are currently being studied in different clinical trials across the globe. The advantage of these drugs is that if they are shown to be able to inhibit the coronavirus in the lab, they can be given to patients without having to first test the drugs for safety. They would still require clinical trials to see how well they actually work in the human body and what kind of doses are needed for them to control or kill the virus. Calling for nursing support amid COVID-19 pandemic. Date June 15, 2020. Source University of Pennsylvania School of Nursing. Summary. In a new editorial, researchers call for rapid policy reform and investment in nurses and nursing in order to leverage the skills of this global workforce. There are close to 28 million nurses around the world who comprise a global workforce that delivers about 90% of primary health care, including frontline response to the COVID-19 pandemic, ensuring their optimal contribution and continued well-being amid the myriad consequences of COVID-19 will increase the potential for measurable and improve health outcomes. The editorial outlines multi-sectoral investments to redesign and innovate existing health services, expand nursing scopes of practice, forge supportive regulations and legislation for nurses, and optimize nursing contributions to best meet global public health needs, and increase the potential to contain and manage the pandemic and future public health and humanitarian crisis. The far-reaching consequences of COVID-19 have shown that we need widespread, rapid, and intelligent investment in nursing through informed action that fully leverages the healthcare workforce. Our communities and the health of populations worldwide depend on these urgently needed policy reforms and increased investment in nursing now more than ever. The recommendations in the editorial are based on the 2018 Worldwide Innovation Summit for Health Report and include implications for nurses and advanced practice nurses, policymakers, governmental and non-governmental health partners, and those working in research, clinical practice, and educational settings. Maternal transmission of COVID-19 to baby during pregnancy is uncommon, study finds. Date June 15, 2020. Source University of Nottingham. Summary. Transmission of COVID-19 from mother to baby during pregnancy is uncommon, and the rate of infection is no greater when the baby is born vaginally, breastfed, or allowed contact with the mother, according to the new study. Research also found that babies that did test positive for COVID-19 were mostly asymptomatic. Many early reports in the literature on COVID-19 and pregnancy suggest that in order to reduce the risk of transmission of COVID-19 from mother to baby, it was safer to have a cesarean, to isolate the baby from the mother at birth, and to formula feed, but there was very little evidence to support these guidelines. To conclusively look at the risk associated with COVID-19 in pregnancy, researchers have undertaken a systematic review of 49 studies looking into the much talked about topic. The studies reviewed included 666 neonates, newborn babies, and 655 women, as some women delivered twins. Of the women who delivered their babies vaginally, only 8 out of 292, 2.7%, had a baby which tested positive for COVID-19. Of the 364 women who had a cesarean, 25.3% of those had a baby which tested positive for COVID-19. These findings show that neonatal COVID-19 infection is uncommon, and also commonly asymptomatic in those babies who are affected. Data also showed that the infection rates to be no higher when the baby was born vaginally. Breastfed are allowed contact with the mother immediately after birth. Researchers say there has been a lot of concern around whether pregnant women should be concerned for the health of their babies if they contract COVID-19. Researchers wanted to look at the outcome for babies whose mothers contracted the virus and see if the route of birth, method of infant feeding, and mother-baby interaction increased the risk of babies contracting the virus. From our results, we are satisfied that the chance of newborn infection with COVID-19 is low. We would also stress that vaginal birth and breastfeeding are safe for mothers who find themselves in these circumstances. Researchers of pediatric infectious disease say they are happy to see that the data continues to be reassuring, supporting keeping the mother-infant pair together after birth, underlining that while occasional postnatal infant infection is detected, clinical course tends to be mild. From the cases of infection in the newborn, we do not have confirmatory evidence that this infection was acquired in the womb or during birth. Good day, this is Professor Will, CBMD PhD on infectious disease, molecular microbiology, and pathophysiology. I hope you enjoyed listening. Until next time, have a great day.